This video will discuss about the bone disorder, which is cherubism. So first of all, coming on to the definition, so it is basically a rare, benign, hereditary, that is autosomal dominant type fibrous dysplasia affecting of basically of jaws involving more than one quadrant, causing bilateral enlargement, bilateral symmetrical enlargement of the mandible, sometimes the maxilla, and stabilizes after puberty. Now, why is it called as cherubism? Uh, because the patients or the children that are affected, they have similar facial features like the cherubs, that are the angels which are on the Roman paintings, or angels on paintings of paintings of Rubel. Yeah. So, on the other names, what we have is familial fibrous dysplasia. Then we have familial multilocular cyst of jaw. Also, we have disseminated juvenile fibrous dysplasia. Now, coming on to the etiology. In etiology, what basically happens is there is a SG3 domain binding protein. इसमें there is mutation. Now, it is present on chromosome 4p16 3. Now, what happens is, if overexpression happens, it will inhibit the stimulation of mast cell activation. Then it will also affect the um, NFATC1. Now, this in turn is going to affect the bone, basically the osteoclast. Then it can also lead to more of the remodeling. All right. Now, there are certain other etiologies as well which are associated with cherubism, and which are very important to know. So, they are, you can remember it by this THALT. Okay. Now, T stands for trauma, H stands for the hormonal dependent neoplasm, A stands for the anomalous development of bone, L stands for latent hyperparathyroidism, D stands for disturbance in bone forming mesenchyme. Now let's talk about the epidemiology. In age, basically it starts from birth, so 1 to 5 years of age. Sex, it does not show any predilection, but however a little male predilection is seen. Site, it is primarily a jaw lesion. Now, a very important line to remember: the earlier the lesion appears, the faster it regresses. The earlier the lesion appears, the faster it regresses. Okay. Basically, what happens is, suppose this is my 14 months, this is 1 year, 2 year, 3 year, 4 year, 5, 6, 7, and then I have 15th. Okay, this is age. So, what you will see is, first it will increase, then it will be stable. After 15 years, it will basically regress. Okay, what you will see is, in first 14 months till 3 years, you will see the starting of the enlargement. Now let's draw a diagram to show what the person will actually look like. the child will look like. So this will be his eyes. You need to draw the eyes just the way I am drawing. So this is an upward gaze or eyes to heaven appearance. Then expansion of maxilla and mandible, cervical lymphadenopathy, then grotesque expression. Now this will lead to problems of respiration and swallowing. Now let's talk about some dental anomalies. To remember the dental anomalies, you can remember CMMP, uh, DD, CAMT basically. So C stands for crossbite, crowding. M stands for malocclusion. Other than M stands for missing teeth, especially the second and third molars. Then P stands for the prematurative loss of deciduous teeth. D stands for the delayed eruption of permanent teeth, and another D stands for displacement of teeth. Uh, Also, in epidemiology, you can mention about the syndromes that are associated. So, first is Noonan syndrome, then Ramon syndrome, and then we have the type 1 neurofibromatosis. You can fetch more marks by mentioning the components. So, gingival fibromatosis, then we have psychomotor disturbances, then we have the orbital involvement, obstructive sleep apnea, then we have the bleeding disorders. All right. uh, how to remember this? Get pinky out of bathroom. So gingival neurofibromatosis, P pinky, psychomotor disturbance, out orbital involvement, O obstructive sleep apnea, B bathroom bleeding disorders. Now coming on to the radiographic features. To First of all, just to mention, there is also a grading system which was given by Enor. So this basically divides the into around 4 grades. Yeah. So you can draw these diagrams in your exam as well. So I'm just drawing it. Give me a little time. Just draw 4 of these. Yeah, we're almost done. I struggled making this one. Yeah. So yeah. So grade 1, 2, 3, and 4. Now what you will do is start shading the parts I am marking as blue. Now what does this show? This shows that the it is involving both the mandibular ascending rami. Now let's go to grade 2. Mark the same one, mandibular ascending rami. Also mark these. What are these? These are the maxillary tuberosity. Grade 1 plus both maxillary tuberosities. Alright. Now let's mark the third grade. So basically we'll go from here. What is this? Whole of maxilla and mandible except coronoid and condylar process. Now here in the grade 4 you have to mention basically please don't shade this, then you will shade this as well, you will shade this as well. Now all of that grade 3 plus the orbits. Okay, so there is orbital compression. All right, so this is it. Now let's talk about the radiographic features. Now in radiographic features, what you will see is you will see a bilateral, well circumscribed radiolucency. So bilateral symmetrical radiolucency. You will see expansion of jaw. Now what you actually see is earlier the lesions occur in the posterior part, then they migrate to the anterior. Okay, um, then you can also mention about this. Just wait, let me draw it. Yeah, so basically this will be broken. So what you will see is at periphery, well defined, corticated, thinning, perforation. Now the internal structure, it actually resembles the giant cell granuloma, central giant cell granuloma. It is multilocular. It has a soap bubble appearance. Okay, soap bubble appearance. So yeah, in histopathology, very important is perivascular cuffing. Now, what is this? This is basically, you will see this. Basically, you will see the eosinophils, all right, and around the epithelial cells. So basically, eosinophils, the small dots are eosinophils. This is the endothelial cell. This is the blood vessel. First is this, then you can see unencapsulated, highly vascular connective tissue, fibroblast, very lot of giant cells which are osteoclast, which are positive tartrate acid phosphatase, tartrate resistant acid phosphatase. Yeah, all right. So we'll mention about this in histopathology. Now coming on to the treatment, according to Laskin. First of all, just remember it is self-limiting, all right. So according to Laskin, the treatment should be based upon the individual or the progression of the case, all right. Basically, should be based on natural cause of disease and clinical behavior of individual case. Now, in severe cases, also surgery is usually not the option. All right, radiotherapy is very much contraindicated because we all know it can lead to possible complications like osteosarcoma, it can lead to osteoradionecrosis. We can give calcitonin because it has anti-resorptive action. Alright, so this completes terrorism. I hope you understood. I tried to make it as simple as possible. Thanks for watching.